Welcome back to Wholesome Health Tips Global, where we're committed to bringing you valuable insights on health and wellness. In today's video, we're delving into a topic that affects many of us in our daily lives: chronic stress. We'll explore what chronic stress is, its impact on our overall health, and most importantly, practical strategies to manage and alleviate stress for better well-being. Before we dive in, don't forget to subscribe to our channel and hit the notification bell, so you never miss out on valuable health content. Now, let's get started. Chronic stress is a form of stress that persists over an extended period, often characterized by ongoing feelings of tension, pressure, and psychological strain. Unlike acute stress, which is a natural and immediate response to a perceived threat, chronic stress lingers for an extended duration, sometimes persisting for weeks, months, or even years. Key characteristics of chronic stress. 1. Duration. Chronic stress is prolonged and persists over an extended period. It can result from ongoing life challenges, such as financial difficulties, relationship issues, or work-related pressures. 2. Intensity. The stressors associated with chronic stress are typically of moderate intensity, but their prolonged nature can lead to a cumulative and substantial impact on an individual's well-being. 3. Lack of resolution. Unlike acute stress, which often resolves once the perceived threat is removed, chronic stress lacks a clear resolution. The stressors contributing to chronic stress may persist or evolve over time. Causes of chronic stress. 1. Lifestyle factors. Unhealthy lifestyle choices, such as a poor diet, lack of exercise, and inadequate sleep, can contribute to chronic stress. 2. Environmental stressors. Prolonged exposure to challenging living conditions, noise, pollution, or other environmental factors can be sources of chronic stress. 3. Work-related stress. Job dissatisfaction, long working hours, a high-pressure work environment, and issues with colleagues or superiors can contribute significantly to chronic stress. 4. Financial strain. Persistent financial difficulties, including debt, job insecurity, or the struggle to make ends meet, can be a substantial source of chronic stress. The pervasive impact of chronic stress on health. Chronic stress, when left unmanaged, can exert a profound and far-reaching influence on an individual's overall health. The effects of chronic stress extend beyond mere psychological discomfort, impacting various bodily systems and contributing to the development or exacerbation of numerous health conditions. Here, we delve into the extensive impacts of chronic stress on health. 1. Impacts on cardiovascular system. Hypertension. Chronic stress is associated with elevated blood pressure, increasing the risk of hypertension, which, over time, can lead to serious cardiovascular issues such as heart disease and stroke. Heart disease. The persistent release of stress hormones, such as cortisol, can contribute to inflammation and the buildup of plaque in arteries, raising the likelihood of coronary artery disease. 2. Impacts on immune system. Weakened immunity. Chronic stress has immunosuppressive effects, making the body more susceptible to infections and illnesses. It can compromise the effectiveness of the immune system in fighting off pathogens. 3. Impacts on endocrine system. Hormonal imbalance. Prolonged stress triggers the release of cortisol and other stress hormones, disrupting the balance of hormones in the body. This imbalance can contribute to conditions such as diabetes and reproductive issues. 4. Impacts on mental health. Anxiety and depression. Chronic stress is a significant risk factor for the development of anxiety and depression. The continuous activation of the stress response can impact neurotransmitter levels, affecting mood regulation. Cognitive impairment. Persistent stress may impair cognitive function, including memory and concentration, and increase the risk of neurodegenerative conditions over time. 5. Impacts on digestive system. Gastrointestinal issues. Chronic stress is linked to digestive problems such as irritable bowel syndrome, IBS, indigestion, and exacerbation of inflammatory bowel diseases, IBD, like Crohn's disease and ulcerative colitis. 6. Impacts on respiratory system. Exacerbation of respiratory conditions. Individuals with chronic stress may experience worsened symptoms of respiratory conditions such as asthma or chronic obstructive pulmonary disease, COPD. 7. Impacts on musculoskeletal system. Muscle tension and pain. Chronic stress often leads to sustained muscle tension, resulting in aches, pains, and even conditions like tension headaches or migraines. 8. Impacts on sleep disturbances. Insomnia and sleep disorders. Chronic stress can disrupt sleep patterns, leading to difficulties falling asleep, staying asleep, or achieving restful sleep. This, in turn, contributes to a cycle of increased stress. 9. Impacts on metabolic effects. Weight gain. Chronic stress is associated with changes in appetite and eating habits, often leading to weight gain. This, coupled with hormonal changes, can contribute to obesity. 10. Impacts on reproductive system. Menstrual irregularities. In women, chronic stress may lead to irregular menstrual cycles and reproductive issues. In men, it can contribute to erectile dysfunction and reduced fertility. Identifying personal stressors. A crucial step towards stress management. Understanding and identifying personal stressors is a fundamental aspect of effectively managing chronic stress. Personal stressors vary widely among individuals, and recognizing these triggers is essential for developing targeted coping strategies. Here's a detailed exploration of the process of identifying personal stressors. 1. Self-reflection. Begin by engaging in self-reflection to explore various aspects of life. Consider different domains such as work, relationships, family, finances, and health. Reflect on recent experiences that have caused emotional distress or a sense of overwhelm. 2. Keeping a stress journal. Maintain a stress journal to record daily experiences, emotions, and stress levels. Note specific situations that evoke stress, the thoughts associated with them, and any physical or emotional responses. Over time, patterns may emerge, revealing recurrent stressors. 3. Physical and emotional signals. Pay attention to physical and emotional signals that indicate stress. This could include muscle tension, headaches, changes in appetite, mood swings, or disruptions in sleep patterns. Identifying these cues can offer valuable insights into the sources of stress. 5. Relationship dynamics. Examine personal relationships, including family, friends, and romantic partnerships. Identify any recurring conflicts, communication challenges, or unmet expectations that contribute to stress. Open and honest communication can be a powerful tool in addressing relational stressors. 6. Financial stress. Assess financial situations and potential stressors related to budgeting, debt, job insecurity, or unexpected expenses. Developing a realistic financial plan and seeking guidance when needed can mitigate financial stress. 7. Health-related stressors. Consider how health-related factors, such as chronic illnesses, pain, or concerns about well-being, contribute to stress. Engage in regular health checkups and consult with healthcare professionals to address physical stressors proactively. 8. Social and environmental stressors. Evaluate the impact of social and environmental factors on stress levels. This could include living conditions, noise pollution, or social obligations. Identifying external stressors provides an opportunity to make adjustments and create a more supportive environment. 9. Time management challenges. Assess time management and productivity challenges. Identify if unrealistic expectations, procrastination, or lack of prioritization contribute to feelings of being overwhelmed. Implementing effective time management strategies can alleviate this type of stressor. 10. Prioritizing values and goals. Reflect on personal values and long-term goals. Misalignment between daily activities and individual values can create internal conflict and stress. Adjusting priorities and setting realistic goals can foster a sense of purpose and reduce stress. 11. External influences. Recognize external influences, such as media consumption and societal expectations, that contribute to stress. Limit exposure to negative influences and focus on cultivating a positive and supportive environment. 12. Professional guidance. In some cases, seeking the guidance of a mental health professional, counselor, or coach can provide an objective perspective and support in identifying and addressing personal stressors. Thank you for joining us today on Wholesome Health Tips Global. Chronic stress is a widespread issue, but with the right knowledge and strategies, we can take control of our health and well-being. If you found this video helpful, don't forget to like, share, and subscribe for more content on living a healthier, happier life. Remember, understanding and managing chronic stress is a journey, and we're here to support you every step of the way. Until next time,